Good morning, everybody. I'm Gabi with Veterinary Animal Services, and we're back today to just discuss a couple topics. And our guest for today is the very wonderful, very special, one of my dear friends, but also an amazing professional. She is a doctor of veterinary medicine at Miami-Dade Animal Services. We have Dr. Lane here, Dr. Jennifer Lane. Oh, excuse us. Derek is also here. Yes, he said, don't forget my introduction. I'm here too. Derek is here with us today. He is a little terrier mixed boy, around 1 to 2 years old. He's a young boy and he's available for adoption. So he's going to be hanging out with us here today. But it's not all about you. We have to talk about Miss Lane here. So we have Dr. Jennifer Lane.
Hello.
So welcome. And thank you so much for taking time out of your day off. It is your day off. So out of your day off to come and do this with us because I have lots of important health related topics that comes to our animals that I want to discuss. And I'm sure it'll be very educational for the viewers. So before that, let's just talk about you a little bit. So I'm just curious because when I was growing up, I always wanted to be a vet, but that did not work out for me. So like what made you pursue this career? Like what is the passion that drives behind this?
Well, like you and a lot of other little kids, I always wanted to be a veterinarian. So I started volunteering at shelters at a very young age. And I fell in love with science as well. So for me, the perfect combination was to become a veterinarian. And I was very lucky to be able to pursue that.
Amazing. And look at you. You're doing great. Dr. Lane, fun fact, she's actually our youngest vet. Yes. So she is the baby vet, but we love her. She's the only one that touches my animals at work. She's definitely touched my adopted dog, which I talk about here all the time. She was the one to do pretty much everything to her. I don't know if you got to spay her, but
I did not.
Everything else she did. But anyways, let's get into these topics. So we have lots of observances that happen, and I know we discuss them every single time I come out here. But this month we have a lot of like health related and veterinary related. So I really thought Dr. Lane would be the perfect one to do this segment. So let's get started. Canine Fitness Month / Active Dog Month. So let's talk about that because one, I don't think people know about that, and I don't think people realize like what is the importance of canine fitness, especially during this month and this observances, and like what could be some common misconceptions that pet owners may have regarding their dog's fitness. And we can use little Derek here as an example.
Yeah, as you can see, he has a lot of energy. So fitness is a great way and exercise to get that out of him. Of course, he's in the shelter, so he gets a little bit less than a dog at home would get. But people wrongly assume that once they become adults, you no longer need to take them on long walks. You don't have to give them exercise, take them on a few walks a day so they go to the bathroom, and then the rest of the day they sit inside, which for a few dogs that is great for them, the older Chihuahua. But when you have a dog like Derek here, they need a little bit more than that. So it's important to keep them active with long walks. There's agility you can do with them. Tailor it to the different breed and the specific dog because they'll each like something different. They'll thrive with something different. Some dogs that maybe can't do as much activity physically, there is food puzzles and things that still get their mind stimulated. So that keeps them healthy. And of course, just like with human obesity, pet obesity is very much rising in America right now. And
lose weight.
Yes, he does need to lose a little bit of weight. Too much treats for him from all the volunteers and staff that love him. So, and of course, fitness is a huge part of that, getting them on walks, in addition to lower portions or more caloric dense foods.
That's important too. Like the food obviously does affect just like the same way us with humans, like fitness and, having an active lifestyle is just as important for your pet as it is for humans. So the same way that you shouldn't be eating like, unhealthy stuff like McDonald's every day. Your pet shouldn't be getting, a whole bunch of treats every day, and look at the like quality of the treats and the quality of the food that you're feeding it, because a lot of, correct me if I'm wrong, but I think a lot of food is like corn based, right? And that's not necessarily like the ideal.
Not necessarily. It all depends on how it was manufactured and what they added into it. So the base of the corn base is not something to be a huge worry about as long as it has the other nutrients that are needed.
Okay. Because I always see like people like, that you should be, for animals, like the first thing should be like a full protein, like not like necessarily like meals, like chicken meal. Like it should be like deboned chicken as like the first. Tell me a little bit more about that.
That's another misconception, that people look at pet food labels and think it equates to what you look at in a human food label. You'll see the ingredients listed, and in human foods, the first ingredient is going to be what makes up the most of the food.
Okay.
In pet foods, that it's not based on that.
Okay.
So you can't, and it goes by weight. So you can't necessarily see, chicken is the first ingredient, there's the most chicken in it, or in another product, oat is the most ingredient, there's the most oat in it. It goes by a little bit different things than it does in human products. So you can't just go based off of ingredients. It's a little bit more difficult than that.
Okay. So ultimately, pet owners, all they need to do is basically just research the food and make sure that it's adequate to your pet's age and your pet's lifestyle, to make sure that your pet remains at a healthy weight, remains active, remains fit per se.
And talk to your veterinarian if you have any questions. So a rule of thumb that I always say is to look to see if it's AFCO approved, or I think it's WAHAVA is another one. And that shows that veterinarians have looked at it. They've done trials on it. They haven't just looked at other trials and based their data off of it. They don't spend their money on marketing. They spend their money on actually figuring out if the food is proper for an animal.
Got it. Okay, so that's also very important. So back to this canine fitness topic. Another question I wanted to ask, if somebody does want to, or if somebody has an active lifestyle, let's say, but they may not have such an active breed per se, or a dog that really shouldn't be exercised as much, like the brachy breeds or the flat face breeds and stuff like that. So like, in regards to keeping those pets active, like what are some of the like warning signs or red flags that pet owners should look for in those dogs to make sure that they're not over exercising these dogs and potentially cause a fatal accident?
So in any dog that's active, you'll see panting, and a normal amount of panting, that's fine. Like he is here, he's a little bit nervous right now, so he's panting. When they go on walks, they'll pant a little bit, but excessive panting, where they're having trouble catching their breath, you'll start to see drooling. They slow down a lot. They'll sit down or lay down and refuse to move. Those are things that are red flags, and you really want to step back and let them rest and take them inside, especially here in Florida where it's so hot that in addition to the exertion part of it, they overheat it. So those two together make it happen a lot faster for dogs here. And brachycephalics, that's a unfortunate it's gonna happen. It's
gonna happen more. It's the flat face breed. So any owners that may be watching that have, very popular Frenchies or bulldogs or boxers or any of those flat face breeds, even small dogs, like I have a Shih Tzu, he also has a flat face. So certain dogs, anything that has like a short muzzle, just keep an eye out, especially if you do decide to engage in making sure that they're, getting active and getting their steps in per se, but don't overwork them or overwhelm them either.
And choose your dog based on your lifestyle. So if you know that you love to go on hikes, or you want a dog that you can take on long walks, things like that,
take Dexter.
Take somebody like him. You don't, as cute as bulldogs are and brachycephalics, they're not going to thrive in that, and they will get very sick, and it's not good for them.
Absolutely. Okay, I think that's pretty much all I had for that topic. Another health related topic, which I think is super, super important, and I think it's often overlooked. I don't think pet parents take it as seriously as they should, especially here in our climate in South Florida with how prevalent mosquitoes are here. So what I'm getting at is Heartworm Awareness Month.
Yes.
Okay. So talk to me about heartworm and why is it essential for pet owners to understand the risks associated with heartworm disease.
Okay, so heartworm disease has now been detected in all the states in America. It was previously thought to only be in southern climates. It is especially high here because it thrives. Mosquitoes thrive in the warm environment and the damp environment, and that is how heartworm is transmitted, through a mosquito bite. So the larva is transmitted, and then it develops into the heartworm in the dog, and it can lodge in the lungs and the heart, and even clog arteries, causing thrombi, and it's pretty life-threatening when it gets to that point. So it's important to be aware of that. And what you can do is keep your dog on year-round. Heartworm protection is super important. Mosquito control for around your area, things like that. But yeah, it's super life-threatening, and it's even if they don't get to the point where they get the thrombi lodged. Overall, it just affects their health. They'll be less active, and it's just not good for them.
Right. Yeah, it's obviously something very serious, and it could be fatal, and pet parents should be doing their part. Excuse you. So you mentioned the preventative measures. So can you talk to us a little bit more about the preventative measures, as far as like, is it an injection? Is it a tablet?
There's
talk to us about the plans and the treatments.
There's so many great products right now that you can fit based on your lifestyle, what's easiest for you. They have topicals, there's oral chewables, and then there are injectables that you can get at your veterinarian. Some of them last for 6 months, some of them last for 12 months, which can be great for those of us that tend to forget easily. Right. So there, your pet is protected for the full 6 months or the full 12 months. Right. But yeah, there's different products.
Chaos. Sorry. Sure. Yeah. Okay, I'm so sorry. You were saying the different types of products.
Yes, we got chewables, we got topicals, we got injectables. So pretty much whatever works for your family and for your dog, there's options. And they monthly, twice a year, yearly, wonderful different choices.
Awesome. So that's really good. And that's really important for pet parents to, understand that they shouldn't ignore that, and maybe next time you plan a visit to your vet, whether it's something that you needed to go for or just, your yearly checkup, ask and make sure that your pet is on heartworm preventative, especially here, like we said, in the climate of South Florida. Dr. Lane mentioned that mosquitoes thrive. Oh, Derek is just having a ball here today. He's like, I'm here. I want everybody to see me. I'm adoptable.
He really thinks
I really want to find a home. He thinks heartworm disease should be prevented. He says he's on his preventative measures. He's gotten his shot at the shelter.
Yes.
Sure. You can chew on it, but down there. Thank you.
Yes, our animals get an injectable that lasts for 6 months.
Yeah. So and we also do heartworm treatment at the shelter for pets.
Correct.
That have that do test positive for heartworm. Right. So can you tell us a little bit more about that? Because I know that there's from what I've heard the other doctors, there's like a monthly treatment that we do every month, and we treat whatever new dogs have come in. And talk to us about the treatment and the importance of the rest and recovery period after, because I don't think people understand that very well either.
So in the veterinary world, there's multiple different options for treating heartworm disease. There's different opinions on what's best. There's different things about what the Heartworm Society will say. What we currently do is all of our animals, as long as they're healthy, when they come in, they get the injectable of the 6 month, the ProHeart, for heartworm disease. And then we test all animals coming in, as all animals should be tested at least once a year.
Right.
And then if they have microfilaria, which are the little worms present swimming around in their blood, then we will give them an anti-inflammatory, and we'll give them a dose of antihistamine.
Okay.
And then regardless if they have that or if they don't have the microfilaria, they're immediately started on a 28-day course of an antibiotic specific to, it's called doxycycline. And it helps with the commensal bacteria that goes hand in hand with heartworm disease. And so it kills that. So they're on that for at least 28 days.
Okay.
And then after that, they go ahead and get, during that period, they'll get spayed or neutered as long as they're healthy, and if they haven't been yet. And then after that period, they will get their first injection of the emiticide, which is what kills the heartworm, the adult heartworm. And they get a bunch of other medications with it, pain meds, anxiolytics to help them keep them calm, things like that.
So that part is super important too. So after they get their treatment, they're supposed to be calm. They're supposed to be remain calm and not get additional exercise. So Canine Fitness Month and Heartworm Awareness Month
it's hard.
It's hard to do it, especially
when you have an active dog. That's the biggest concern people have. How do I keep my dog active? Yeah. So we do the two injections, and then after that they have to remain pretty calm for about 6 months. So
months or weeks?
No, months. Sorry.
Oh, 6 months.
Yeah, 6
wow,
months.
That is a long time.
Because during that time, the heartworms are dying, and so if you get them too active, they can get lodged in different parts of the blood vessels, again causing those thrombi, and it can be severely fatal. So you want to keep them pretty calm.
Wow.
During that time is when the mental stimulation is super important.
Yes, all the puzzles, all the brain games, but ultimately, the best thing to do is just prevent it. So you don't even want to
you don't want to get to that point. You don't want to put your
imagine having to keep your pet basically on bed rest for 6 months. Like my older dog, maybe, but my youngest dog, that would be really difficult. So the best thing to do is just prevent it from getting it, especially with how accessible preventatives are nowadays.
And it's cheaper than treating. So yes, a lot cheaper. And the injections, though they're the best way to treat it, the imiticide, they're not benign. So, you don't want to put your animal through that if you don't have to.
Right. Yeah, it is a very extensive treatment, and just even the recovery seems like I can't imagine being like bed rest for 6 months. Like that just seems crazy to me.
And so an important thing though that I will say that people forget is that cats can also get heartworm disease. So keep your cats on heartworm prevention, even if
they live
inside, because mosquitoes come inside all the time. I know I get attacked by mosquitoes in my house sometimes.
Same.
So yeah, and there's no treatment for cats, so it's even more important to keep them.
That's so sad. Oh, wow. That's interesting that they don't have a treatment yet for them. All right. Now, another yet important topic. Like I said, we had lots of health-related topics this month, and I really thought the best person to do this would be a professional, a veterinary professional. So another very important thing that's also happens all over the country too. But Lyme disease. And this month is Prevent Lyme Disease in Dogs Month. So does that mean that cats can get Lyme disease, or is just okay?
We can get Lyme disease too.
I've heard of that. Yes. I believe it was like Justin Bieber that had it recently or something.
He had some. He might have had Lyme disease.
So.
He had some sort of a disease. Yeah.
Okay. Yeah. Don't quote me if I'm wrong. Just say I think it was.
I don't
him.
follow super close to that, so I can't tell you for sure.
That's also interesting. It's Prevent Lyme Disease in dogs, but also cats can get it. So talk to us about Lyme disease. What is it, and how is it contracted? Like, how do dogs or cats, whatever, get it?
Lyme disease is actually a bacteria that animals or humans or whatever will get through a tick bite. So there's various tick species that actually carry that bacteria that causes the Lyme disease. There's some that are more prevalent than others. And then there's some areas that are more prevalent of having those ticks than others, but it's a problem everywhere. So the tick has to be latched onto the dog or the skin for at least a day to contract it. But a lot of times people don't even see the ticks on their dogs. So it gets that ability to transmit the disease, the bacteria.
That is scary.
And it causes some pretty bad things too. Like they'll get super lethargic, they'll have joint disease, lameness. It's just even kidney disease and neurological issues eventually. So something we want to prevent.
Definitely something we want to prevent. And again, what is the best way to prevent these measures?
So there is a vaccine that some veterinarians carry, but also just if you go on walks, especially if you're going into the woods, on hikes, or if you travel to areas such as Connecticut, always check your animals when you come back. Do a good once over, brush your hand through, comb them if they have longer fur, so you can make sure you get a good view to see if there's any little ticks there. Some of them may be big, but there's little seed ticks too that are the little babies, and those are also bad. We want to take them out. Common things. Oh, you broke your
it's fine. Let him have fun.
Common things are common places they like to lodge to look is under the gum line. So people don't think to look there. Within the ears, in between the toes, the webbing.
The toes I knew. Yes.
In the genital area. So those are good hiding places to make sure that you look at.
Too, right?
Yes, the armpits. Yeah, and then even us, if we go out into a wooded area, even without our pet, check yourself. Go take a shower. Make sure it's all off.
Make sure you get them off.
From us over to the dog, and then also
vice versa.
Exactly. And then, like we said, humans get Lyme disease too, so we don't want that either.
Yeah, it's not. That doesn't seem fun. No. I do not want any ticks on me for sure.
No.
I have seen, obviously, we when I used to pick up dogs in the field, I have seen ticks on dogs, and then like in the process of me picking them up, I'll see them on me, and it was just immediate panic.
Heebie-jeebies, yeah.
Yeah, immediate panic. It's like a roach landed on me. It's disgusting. But yeah, it's very important. Flea and tick preventatives are sold everywhere. You don't even need a prescription for them most of the time, but the prescription ones usually work better, right? Like I have my dogs on a 3-month flea and tick preventative, and then I have them on the 6-month Pro Heart injection chart. So they're taken care of because I do not want that expensive vet bill of when they do catch something that could have been prevented.
Right.
So it's very important to prevent this. And ticks are everywhere. Like literally, it doesn't even have to be so much a wooded area. Like just
That's true.
An unkept grassy area. Like my dog loves to walk on this patch of grass 2 houses down from mine. She loves to go there, but as soon as I bring her back home, I'm like immediately checking her paws. Like even though she's on preventative, like I'm just like super paranoid about it. And I just immediately spread her little toes and like open up her paws. And I'm like, okay, let me check anything. All right, you're clear. Good to go. So just even a simple step as doing that goes a long way. But the best thing to do is obviously just put them on a preventative.
If you do see the ticks, it's important that they're removed correctly too.
Okay, so tell us about
that. Not everybody knows. So if you find a tick on your dog or your pet or whatever, even on yourself, you want to use like tweezers or something to grasp the head of the tick. Okay. You don't want to get the body, you want to get the head and pull straight back to make sure the whole entire tick
comes off.
Correct.
Because it could break off.
Correct. And if the head stays lodged in there, it can still transmit the disease. And so you don't want that. And to kill it, you can just put it in a bowl of rubbing alcohol. And
don't pop it, right? Because that's not, or is that like a myth? Because like I don't know why I have like, maybe I'm that person like Dr. Pimple Popper. Like I just love popping things.
If they're off the animal, you can. I don't pop them unless I put them in hydrogen peroxide because I have a weird fascination and I think it looks cool to see the blood all bubble up.
Stop! Oh my god! Like now I want to experiment. I know that sounds so weird.
I don't recommend doing
that
it though.
Sounds so weird.
Because
you're like, oh my god, these crazies from Animal Service.
Exactly.
But I've always heard like it's not good to pop them. I guess it might be like an urban legend or myth, but because of their blood could be contaminated, and if you can,
well, for sure, that's why I don't recommend doing it.
Okay, so it is true. Okay,
yeah, you don't want to touch any of their blood contamination or anything like that.
Gross.
But,
God, this is interesting because like we've never really gotten like deep and dirty about like illnesses.
The thing about veterinary professionals is we love some gross stuff.
True. That is very true. And I'm not a veterinary professional, but I love it too. Like she'll call me all the time or she'll send me weird videos of like surgeries and abscesses she's popping and I'm like, oh, I love it. Send me more. All right. So I think we can go into our last topic now. Okay. So this is more generated towards you as a veterinary professional. Apparently, I think it's the 28th of this month is World Veterinary Day. So we were just talking about it earlier that you didn't even know that was a thing and you're a vet. Yeah. So that's interesting because like I knew about it because I've heard about this day. It's just the random day that pops up. You know how like we have like National Dog Day and things like that. Like I've seen it, I guess, across like social media platforms. And I was like, okay, cool, World Vet Day. But what would that day mean towards like you as a veterinary professional or the veterinary community, and how does it contribute to raising awareness about the critical role of veterinarians in animal health, animal welfare, and even the public health? Yeah. So
I mean, that's super exciting to know we have a day.
You have a day, you're celebrated.
Yes. So believe it or not, veterinarians play a significant role in the community and into the health of a population. So not just taking care of dogs and cats, we also protect the food supply and make sure what you're eating is healthy and safe.
Got it.
So it's important to just showcase and look at all the things that we do. Especially right now, there's unfortunately a crisis in the veterinary community. We're not getting enough veterinarians in. It's very stressful, especially with social media. And things like that. So it's great to be recognized, and we like I said, we do a lot of things for the community. We take care of your beloved pets, horses, cows, and then we also work closely with human scientists to develop vaccines and other things during disease outbreaks. So we do a lot of things.
No, you obviously do a lot of things, and it does make sense because like you don't even think about, because like obviously you're a domestic animal vet, you work at a shelter, like that's what you followed, but there's many different types of vets. Yes. There's obviously vets that take care of livestock, and like you mentioned, like that's the food that we eat, so they're making sure that those animals are okay. But then we have also vets that take care of zoo animals and large animals and species, so that's obviously super interesting as well. And then you mentioned that we are lacking vets. We specifically at our animal services, we need vets. So we are hoping that a vet will see this. Hopefully you share it, or you share it with somebody who's either just finishing vet school, just, getting out there fresh, or just even a vet, you never know. They could just do like what is it, like a per diem or like a
relief, even helping us out.
Relief vets. That's the word I was looking for. So we could definitely use the help. This is not, this is about, the topics that we discussed today. But, now that she mentions that we do need vets, this is also a recruitment video. So, we really could use additional help. Even like Dr. Lane said, just relief helps us, even if it's just one day that you can give up a week. Or if you just wanted to volunteer, there's many ways that you can help us, but ideally we do need like a hired vet. You're gonna be paid. Yes. But yeah, if somebody's watching or somebody that may be interested, just send them over to our website. There's a lot of information on how to get in contact with us and just get that rolling, because we've had a veterinary position or several veterinary positions open for a long time, and we're just waiting patiently for applicants to come through and join our team, because we need it. The shelter pets need it, because as you guys know, we stress all the time about how many animals we have. We have over 650 dogs in our care, plus like another additional 100 cats. So it is a lot to keep up with. And how many vets do we actually have right now?
I want to say about 8 or 10.
8 or 10.
I would have to count, and
It's okay. So 8 or 10. And do you know how many we're supposed to have? Because obviously we have openings, but
I believe we have 2 more openings.
Okay, so we're supposed to have around either
10 or 12.
10 to 12 vets.
Yeah.
Okay. So 10 to 12 vets to take care of the entire population of the shelter. And the public, because we also have vets. Like on the way here, we saw the vet that comes and does the vaccines for the public. So it's not just taking the care of our animals, it's also taking care of the public's animals, because as you know, we as animal services offer vaccines and microchips to the public. So we have to have somebody there to do that as well. So it is very, very critical to have the full staff to be able to adequately not just take care of the animals, but also to, prevent any burnouts between you guys as well, because it is a very stressful job at the end of the day. Like you guys have to deal with some, not only making some tough decisions, but also just having to deal with probably a lot of cases of cruelty, which I know I've had to deal with. I mean, not as a vet, but I've had to deal with some cases in the field where I would just go back in the car, I put the animal away. Like, I know this animal's on the way to being saved, but like, what if I didn't get there in enough time? And it was just like break my soul. And it was just like make me cry sometimes. So it is really, really stressful on you guys too. And I think that's another thing, like it's not on here today, but I think there's also like a day to celebrate like the mental health of like doctors and veterinary professionals, because that's also very important. And you guys are under a lot of stress. So it's very important to recognize that. And me personally, I want to thank you, because you are amazing. You're very brave and you do so much. And I know that you genuinely care about every single patient, even if they're there just because they got a little nick in their ear, or because you're spaying them, or they have to have a massive surgery or procedure done to them, like how you did with our girl Luna, who was a dog that was with us. I think it was like back in June or something like that.
It's been almost a year.
Almost a year. She was a very good girl. And she came in with like a really bad infected wound in her back. And Dr. Lane treated her. And not only did she treat her, she just didn't do her general, like, okay, the pet's treated, move on, I have another pet to take care of. Like, Dr. Lane would go out of her way to go and check on this dog, to take her out for walks, she would pass her on to me, like, please feature her, please try to get her adopted. Like, she did her part to make sure that this pet ended up in a home, and she did. So again, it's just that sense of compassion, and that's what we want in like the people that come and work for us in animal services, not just as veterinary professionals, but anybody, as far as our entry level positions from kennel to as far as management. Like, we just want people there that care. So again, if you're watching and you know somebody who loves animals and would be perfect, especially for the veterinarian positions, please send them our way. But if not, if somebody that hasn't gone to vet school but still interested, we have positions that open all the time, especially through our kennel position, which is the most hands-on position with dogs and cats. So if you're an animal lover, we would love to have more people join us and come on board. And Derek's been tearing it up.
And you mentioned all like the stressful parts of the job, which yes, it can be very stressful, but it's also extremely rewarding. Being a veterinarian in general is rewarding, but I think particularly, I love shelter medicine because you're helping these animals that come in sometimes never having had a loving home.
Oh, yeah.
And then you're seeing them transform, sometimes super scared, and then they come out of their shell, super friendly, they get adopted. Or with like Luna, she came in very sick. We weren't sure if she was going to make it. On a whim, I decided to all do what I could, help everything, put everything forward. And she thrived. And to see that transformation from a huge necrotic wound with even maggots in it.
Yeah, that was really bad.
So now
wound.
you can barely tell she ever had.
Yeah, she's just a little bald spot, but it's cute. It gives her personality.
Yeah.
And she's just the cutest little thing. She actually looks a lot like Derek, but smaller.
Does, yeah.
Smaller and a little darker.
Yeah.
But that's pretty much it. That's all we have for you guys. And Derek is still down here. He is available for adoption. As I mentioned, we have more than 650 pets. So we would love nothing more than, other than hiring a veterinary professional, than to get as many of our pets into loving homes. So again, if you're watching this, just please share this with an animal lover. You never know who you're going to reach and what impact that's going to make on them and on us as well. So thank you guys as always, and we'll be back soon.